Welcome back to Body Beautiful. Our guest today is plastic surgeon Dr. Joseph Mealy, and we're talking about cosmetic breast enhancements. We're also taking your calls, answering any questions you might have for the doctor. That number is 800-440-4884. We'll also be posting the number to his office, so be ready to jot that down. And any advice we give you today, you'll certainly want a second opinion as well. Let's go right to the phone lines. We have Athena from Vallejo. Good morning, Athena.
Good morning.
Hi. Do you have a question for Dr. Mealy?
Oh, well, yeah, as I was talking to the gentleman before you, I've got two questions.
Okay.
Before, I have breast implants right now. Before I had these breast implants put in, and also they are silicone implants. I was an A cup, and then after, I was a 34A to be exact. And after the implants were put in, and I put on some weight as well, I'm now a 38D.
Okay.
So I had two questions. It's been about 4 years, 4 to 5 years already, and I'm getting a little worried as far as my health is concerned. What is a safe, like, is there anything considered a safe zone as far as the period of time to have the implant inside of my body?
I mean, how long can it safely be inside your body?
Yes, because now I'm at a point where I want to have them removed and have like a bigger implant put in.
Oh, okay.
So what would be like a good time for me to get that done?
You know, I think a good rule of thumb is to wait a year, and that's enough time for the body to really have a mature scar around the area and to be sure that it's going to adjust it the way you want. So if you've had implants for 4 years, certainly would be safe at this point to consider, you know, doing something or changing the size. But be a little cautious when we're going over D's. Sometimes I can give people the problems that people who want reductions have, which is neck pain, back pain, and that sort of stuff. So always be sure, if you're going to do that, that you talk with your surgeon and figure out what might be some of the problems that happen as we start getting larger than D.
Okay, thanks, Athena. So height and frame and all those factors,
Sure.
Is that something you take into consideration when you
have to
recommend?
Sure. No, if I used a 300cc implant on someone who's 5'2" and 90 pounds, it's going to look completely different than if I put it in someone who's 6'4" and weighs 200 pounds. The 6'4" person will ask me, when are we going to do surgery? They're just not going to see enough of a change. Because I've had patients who are bigger who want to have their breasts match their body. The largest implants made currently are 800 cc's. And I have a patient I put 800 cc implants in, and it looks perfectly natural.
Okay, for those of us who aren't scientists, 800 cc's
this big.
Okay.
It's like half the size of someone's head.
Yeah.
Which would look ridiculous on most people.
Right.
But on her, it looks absolutely fine.
Okay. We had a caller who we lost, and she had a question. I think it's kind of important to ask. B from American Canyon wants to know, she has type 2 diabetes.
Okay.
Is surgery okay?
Sure. Like any, extra thing that we're worrying about during surgery, pre-existing medical problems are certainly one of them. The most important thing is that it's well controlled. And a lot of times in those situations, you want to make sure that the glucose is kept within the normal range, and that I'll monitor it more closely during surgery and right after surgery, because surgery is a stressor. Sometimes it'll bump the glucose level up, and we want to be sure it gets back to that normal range quickly.
Okay, well, who is a good candidate for this type of surgery?
Most of the folks for the breast augmentation, it tends to be younger women or women who've had children or done having children. I think that's a nice time to do it because childbirth can change the shape of the breast, and I've got a more stable platform to work with, and hopefully we get a longer lasting result that way.
Okay, and we saw pictures earlier and we were talking about breast lifts. How are the breast implants actually used in the lifts? I mean, can you have...
The breast implant is used to add volume. So if someone needs a lift and they're not happy with their size, then I'm usually using an implant with a lift. And I put a whole page together on that just on the sanfranciscobreast.com that talks about that specific combination of breast lifts with breast augmentation. That's very common.
Yeah, pictures are worth 1,000 words. For the folks who are interested, they can just check out
I think it helps. Yeah.
We need to take a quick break, but for more information about Dr. Mealy, you can call him directly, 925-943-6353, or check him out on the web at drmealy.com. He's also on sanfranciscobreast.com. And when we come back, we'll continue talking with Dr. Mealy, plus take your phone calls. That's next on Body Beautiful.